Good morning, everybody. My name is Chase Ballard. I am just getting in from a long shift at work, so I'm a little sleepy, and I hope I don't get too monotonous or boring and that you guys can follow along. I'm also going to try and make as much eye contact as I can, but I do have my notes pulled up here to be sort of my guideline, so I may glance over every now and then. This week we were supposed to think of something within the United States healthcare system that we believe needed to be changed or improved. And I chose that we should offer affordable and accessible healthcare to all people in the United States. I decided that I would make this change because I believe that healthcare is a human right, and I believe that we, to be such a developed country, need to focus more on providing health care to our citizens. There are numerous other developed countries like Canada and France, Switzerland. You look at these places who do have more of a universal health care coverage option. Patient outcomes and benefits and nursing job satisfaction, all of that has been linked to those kind of systems. So I do believe that it would be a great thing for America to adapt. I cited an article in here by Tanny. The American College of Physicians says that the United States needs a healthcare system that provides care for everyone. Two possible proposals were discussed in this study. One was a government-ran system that would be based on the ability to pay. So this, you could reflect back to the Obama administration during the passage of the Affordable Care Act. That broke healthcare down into ability to pay, and also they couldn't deny because of pre-existing conditions and other things like that private insurance companies can and do. The second option was for a pluralistic system, and that involves the government as well as private sector insurance companies that are able to, offer their own packages. And the problem I have with that is that if we decide to believe it or not, I do believe that people are treated differently based on insurance. I think a lot of the times, people who do have these higher end private insurance companies can get, what they need when they need it. And then someone, let's say, who is on Medicare or Medicaid struggle, to get their basic healthcare needs met. So that is definitely an issue that I believe we as nurses should stand up to and should get behind and work towards changing for our future in healthcare. So, where did we go next? I pretty much talked about the role. So, according to another study I found by Selman and Echevarria, in 2017, they found that registered nurses are required to be a full partner in the relentless efforts to achieve improving healthcare and aim for an improved patient experience of care, which includes quality and satisfaction, improved outcomes, and a reduction in the overall cost of healthcare. I think that we as nurses are called to, improve our patients' outcomes, and cost is something I personally don't think about a lot in my day-to-day practice, and overuse of materials and wasting, but that is also something that I think that we in the nursing field need to look more into finding a solution for. I actually did find a statistic too that it is estimated that 30 cents of every dollar spent on medical care in the United States is wasted, which amounts to an overall $750 billion annually. That was by the same Salmon and Echevarria, which is crazy to me. That's $750 billion that we are wasting. So we definitely need to find a way to fix that in the future also. I actually thought about it because I had wrote this yesterday. So last night at work I was like, you're not going to waste. You're not going to waste. I'm sure I still did waste something, but it's crazy when you think about it. I believe that nurses are also positioned for the role of endorsing patient and family-centered care. I think that evidence has shown, that patient-centered care is the way of the future and it is the best, because we can't ever tell a patient how they feel. we need to, involve them in their care plan and follow out their wishes, and their families that are involved also. The type of nursing care delivery model that will need to be in place by 2020, I refer to our text, Sullivan, and I believe that there always is going to be an evolving healthcare need, so there will always be a need for us to evolve the care that we deliver. But I think that for my idea of providing universal access, that we should follow the synergy model of care. It was developed by the American Association of Critical Care Nurses, and it conceptualizes nursing practice based on the needs and the characteristics of patients. So this is putting patients first in the care, like I mentioned. And it also is useful for nurses because it can delineate job descriptions, evaluation formats, and the advancement criteria. This synergy model of care has also been linked to hospitals that have achieved magnet certification, which most of us know is a pretty big deal, and can prove that both the patients and the nurses at the facility are pleased with what's going on. So I think that would be a good delivery model to adapt, would be the synergy model. Restructuring activities that may need to take place by 2020, I put that there would be numerous aspects of the environment, obviously, because healthcare needs are ongoing. I believe it would be important to focus on the need for team care. I think that a lot of times in nursing, we have so much responsibility over our patient load that we sometimes forget to ask others if they need help or what we can do for them. And I think that it's something I always try to do, but I do know that I am at fault for not offering myself as much as I should. So I think that is, from the nursing aspect, a great thing that we could carry forward in the future, is if we started working as a team better to provide care for all the patients on the unit. I also put that we should focus on the entire population. I think now that healthcare, we shouldn't just have hospitals and emergency rooms. We should have prevention clinics and wellness centers and things like that. I think that healthcare companies should branch out into being more holistic and not just caring for people when they're acutely ill, but offering them preventative measures and treatments as well. And then lastly, the criteria used to evaluate the effectiveness. I put that we could still use the patient satisfaction survey that we currently are using now. I think that if we made all of these increases or all of these changes in our healthcare system, that we would see an increase in patient satisfaction. I think nurses working together as teams, better communication, access to healthcare for all people, it puts everyone on an equal playing field, and I think that is a big deal in healthcare. I think that it can be political sometimes, but we need to remember to always put our patients first, regardless of, we took an oath, regardless of who they are or what they are, that we will take care of them. And I am a strong believer that should still be how we run things, so regardless if they're uninsured or not. But that is my big, bright plans for the future of healthcare and nursing. I am glad you guys made it through it, and myself. I am going to go get some sleep. Signing off.